Good evening and welcome. Let's take a look at the top story that we are tracking for you. The Omicron variant has triggered an alarm across the world. Here we will answer some of the frequently asked questions about this coronavirus strain. Now, first of all, let me tell you a few important things about this strain. It was first detected in South Africa. The strain has a large number of mutations and has been classified as a variant of concern by the World Health Organization. How is Omicron different from the existing variants? It shares a few common mutations with the Delta strain. It has a number of additional mutations and also has a different evolutionary pathway. Now, is Omicron more dangerous than the Delta variant? It is considered to be more transmissible than the Delta strain, which fueled fresh COVID outbreaks across the world earlier this year. Now, are the symptoms different in the Omicron variant? Now, no unusual symptoms have been detected so far, and some individuals affected with Omicron remained asymptomatic. Do the existing vaccines work against the strain? At the moment, more data is needed to further understand the variant's impact. However, vaccines are still likely to offer a high level of protection. Are booster jabs required to tackle Omicron? Now, as I said earlier, pharma giants are also awaiting more information. They may modify the existing vaccines if such a need arises. Are tests able to detect the Omicron variant? So far, the data has shown that the strain is unlikely to affect the overall PCR test sensitivity. However, countries have also been carrying out genome sequencing. And for more on this, WION correspondent Culden Ongwu is joining us live from Johannesburg. Good evening to you, Culden. Firstly, has there been any new updates or information from the government side?
Yes, so I did speak to the country's Minister of Health this morning. He said scientists and experts are working around the clock to try and give us more information on the new variant Omicron. He said he doesn't have much on new information as of now, but definitely those individuals that have tested, that are being tested positive, are a mix of vaccinated and unvaccinated individuals. He also mentioned that at least in the country's capital city, that's Pretoria and Johannesburg, 90% of the people that have tested positive are carrying the new variant Omicron. Last week, experts said so far 22 people were tested positive with the new variant, but we are still waiting for an updated number from them.
What is the situation on the ground? There are reports that people have been stranded at airports. Is there chaos and panic?
So the situation in South Africa on a whole is still very calm. Yes, the announcement on the discovery of new variant was made last week, but business is as usual. There has been no sense of panic or chaos amongst people here. In fact, even the minister himself said it's too early to call on any hard lockdown as of now. But the meeting of the Coronavirus Command Council is ongoing, and when that is over, hopefully by the end of day today, we could be briefed by the president. That announcement will be made soon. But of course, the citizens have been warned time and again to maintain all necessary precautions, not to remove masks in public space, and avoid large gatherings. However, going back to your question on the airport situation, yes, there are foreign travelers, especially those from the UK, that are scrambling to get their tickets for the last available flight home. As you know, most of the EU and Asian countries have imposed travel ban on southern African countries, and flights have been cancelled.
Now, with the number of new positive cases rising daily, is the government prepared to face the worst?
The number of cases have risen drastically from last week. Today, for instance, we are sitting at 3,220 cases as against 800 last week. That's a huge jump. So this morning when I spoke to the health minister, he said the last 1 year has taught them a lot. He said the government is ready. They are in constant communication with experts and scientists as well as with officials in the healthcare facilities, making sure there is enough beds, oxygen, staffs, medicines that are required, when time comes. However, he did say that it's still early, but cautioned the public to take all necessary precaution and called on those who have not been vaccinated to get the doses as soon as possible.
Calden, thank you for joining us on this broadcast and bringing us all the latest information.
WION, now available in your country. Download the app now. Get all the news on the move.